So you already gave me also the perfect transition to our panel that's coming up, visualized thanks to AI in action figure manner, is our next moderator here on stage, someone who's been to all 11 editions of the ICT and Health World Conference. He's the CEO of Transform Health. He's the Chief Strategy Officer of ICT and Health and the chair of the ICT and Health World Conference. Ladies and gentlemen, please put your hands together for Lucien Engelen, who will introduce our next panel and explore the future of health.
Thank you very much, Suni. Isn't she great? Thank you very much again. Thank you.
Enjoy and have fun on stage.
We will, thanks. So after this signature Daniel Kraft storm, I think it makes sense to digest a bit of the nuggets into that. For that, I've invited a couple of friends to figure out what is next after this era where we're utilizing technology to fix stuff and gradually using that data and the other technology also to prevent stuff. But it takes more than the change of a mindset. It takes a change of culture, of systems, of behavior in the broader sense. So I'd love to introduce three of my friends to the stage. First up is Dr. Larry Brilliant. Larry, could you join me already on stage? Dr. Larry Brilliant. Dr. Larry Brilliant has been crucial during the eradication of smallpox back in the days in India. Please take a seat on the couch. Thank you very much. He was also the director of Google.org, and he's now, together with his son Joe, creating a great new startup called Evity, and you will hear also about that. Next up will be Dr. Jack Kreindler, who is the perfect example of merging a scientist as a physician. You get a crazy Brit. You take the next chair next to that. And Jan Liska, Jan from Sanofi, being the global head of population health strategy for Sanofi, and we'll introduce them a bit broader shortly. So, Larry, after this storm again of Daniel, which I think it was 211 slides or something like that, probably. When you look at the changes that are made right now, and you always talk about this, not about lifespan and health span, but sick span that we need to decrease. What are your thoughts about the biggest objective and the biggest challenge that we have in that?
Well, first of all, Daniel, you're amazing, and I think you're robotic. I think you've got AIs installed in your fingertips, and I love you, and I'd like everybody to applaud that. You just saw a master class in the future. Now, that having been said, I think that all of us recognize that when you hear about COVID, you know that that was a pandemic. When I tell you that smallpox, which was the worst disease in history, which in the 20th century, which was only 27 years ago, smallpox killed 500 million people, mostly children. Going all the way back to Pharaoh Ramses V, we've actually found smallpox in lesions on the mummy of Pharaoh Ramses V, all the way to a little girl named Rahima Banu, who was the last case of variola major in the world, showing that humans, working from 200 countries, every color, every race, every language, could work together to conquer that disease. You understand that was a pandemic. So COVID's a pandemic, smallpox was a pandemic, and today we have another pandemic which is going to threaten everything Daniel said. And it's a pandemic of sick span. What is sick span? Life expectancy at birth in the world is in the high 70s, 77, 76. In most of Europe, it's in the 80s. It is not equally distributed. In the county that I live in, you can go to Ross and life expectancy is 92. You can go to the African American majority area where they built the ships in the Second World War. Life expectancy is 69. Life expectancy is one thing. Health span is another. Actuarial scientists say there is a lifespan, health span gap That gap is when you're sick. That's sick span. In the United States, it's 15 years. All over the world, it's 14 years. You are sick a higher percentage of your life now than ever before with Alzheimer's, with cancer, with diabetes, with obesity, with medical emergencies. This is not normal. And it doesn't have to be, and it threatens everything that Daniel said. In fact, sick span is where we spend 90% of our healthcare budget. In the United States, the budget is $5 trillion. That means we spend over $4 trillion in sick span.
Fixing stuff.
Say again?
Fixing stuff.
Fixing stuff. Fixing stuff that's already been broken by a lack of prevention. Sick span is eating our healthcare, and the expanding budgets for healthcare are eating our GDP. It's a global emergency. It's happening in real view, real time, real life. I think we need a movement. I think we need to create a meme. I think we have to have a target. And so that everything that Daniel is giving us can be focused on one agreed goal that we can make today. Let's say we want to increase health span globally by 1 year. Reduce sick span by 1 year. Take it down from 14 to 13 years. Increase health span by 1 year. That may sound like a lot, but first of all, it's equitable. Because if you're going to increase average health span, where are you going to get those years? Not for the people in Ross near me who have a lifespan of 92 at birth. You're going to get it from the poorest and most vulnerable. It's equitable. Number two, it organizes our thinking. Is what we are doing going to decrease sick span, increase health span for all, on average? It's an organizing principle that we can look at, and we look at all the things that Daniel and the future and AI are bringing us. And secondly, it will save our hospitals. In the United States, we have 6,000 hospitals. The best estimates are 2,000 will go bankrupt in the next 5 years because sick span is eating hospitals. So I'm going to talk more about this in my keynote later on this afternoon. But I want you to think about the way we can have an organizing principle, come together on a mission, bring memes to it, bring all the power that we have of social media and technology, and focus it on a singular goal that will help us realize WHO's definition of healthcare, WHO's definition of health for all. And we can do it now. Thank you.
You triggered WHO. You worked within WHO for many, many years. And I think all of us have witnessed what happens in the past couple of weeks with the WHO. Is a brief reflection on that from your end, maybe? We can't ignore it, let's be honest.
So we talked last night about the fact that this week the Stars and Stripes, the flag of the United States, was lowered and taken off of the front mastiff of the World Health Organization at 127 Avenue Appia in Geneva, which I spent a lot of time in. What does that mean? WHO has lost the United States? It really means one person, Trump, has removed the United States from the world. And there's something really sick about that. The idea that you would leave the World Health Organization, which, by the way, if you go back in the history, it's the United States who constructed the structure of WHO, which admittedly is the worst organizational structure you could ever have. If you were starting a company, would you put on your board of directors your shareholders, your investors, your customers, and your parents? Never. That's the structure of WHO.
Sounds like an academic medical center.
Yeah. Well, remember Peter Drucker once said, the organizational theorist, he said the most complicated organizations ever created by human design are hospitals.
Yeah.
But WHO plays such an important role in setting standards, in equitably helping to distribute new ideas, bringing people together. We could not have eradicated smallpox without the World Health Organization. We cannot complete the job of eradicating polio without the World Health Organization. So for me, it's a very sad day.
Or the next pandemic.
Yeah. So I helped to make a movie, Contagion. I don't know how many of you saw the movie Contagion.
Please do.
But I was persuaded to make a fictional movie because doing a documentary would never get watched. And so we made a fictional movie with really good science, I think. I think that we also need to create a narrative that we know what a pandemic is now, even though I wouldn't say that COVID was the worst pandemic we've ever seen, certainly not. There could be some worse, and they could be intentional. Let's not forget bioterrorism, where today, because of all the technology changes and medical changes, a high school student with a $500 budget and a high school wet lab could create a pathogen that could kill hundreds of millions of people. So we must be vigilant. We shouldn't be scared. We shouldn't spend a lot of time thinking about it. But we should invest enough that we really understand that we're prepared. We're less prepared for the next pandemic now than we were before COVID.
Ouch. Ouch. Wow. Well, thank you. Jack, there was a lot of buzz going around about longevity. And I think over the past couple of years, it's rebranded, reframed, and everything that you want into it. And the more technology, the more AI, the more data comes into it, the more social media use of influencers and what have you are trying to share that you can live up to 140 years. I think, first of all, my question to you is that how do you look at that shift going on at one end? And second of all, what can all of us do in that sphere also, not so much only on social media, but in making sure that we have the proper things going on. Meanwhile, the statue of science is becoming diminished by the day by the use of that same social media as an example.
Well, if we are going to live to 140, I do jolly well hope that we maintain a sense of humor. But humor, optimism, moral courage, I think, are essential at these times. The point about longevity, it's really a little bit like AI. It is a reframing of words. It's a rebrand. And I would say that at least now we have a word which I struggle with, because we have only in mice proven that we can change your death date. We have not
Go
yet
tell
done
social
that.
media
Yeah,
that that's the case.
I mean,
Only in mice at this moment.
we might be able to say that, you know, Mr. Brian Johnson perhaps is showing indications, or maybe it's Brian's Johnson, I'm not sure, will live longer because of all the interventions he's got. But frankly, what we have is we've rebranded prevention, which has a defensive and unattractive sort of vibe about it, into something that is perhaps more proactive and aspirational. So for that, the word longevity, for its flaws, is a reasonably good reframing. It's a little bit like AI is also now reframed from machine learning or statistics, for that matter. So I like that. The reality, though, is where we are today is the projection of lifespan is exactly as Larry says, not looking at the compression of sick span. And we have to really deeply focus on crushing the morbidity period. That is not only essential for me and us as parents, as brothers, sisters, as people who are working and who are going to have to work more, who are going to be who are going to be dependent on others for longer if we don't crush that gap. That whole gerodemographic crisis means that it's not just a personal thing. It's not just about you and me feeling healthier and happier for longer. It's a societal obligation for us, individually and as health systems, to crush the gap between health span and lifespan. in my work, mixing technology from a very, very young age with new models of practice that are inaccessible to most, but they represent what could be normal and affordable in the next 10 to 20 years.
As it always starts with the people that have some money to spend,
Sure.
and then it gets commoditized, and in the end of the day, it's becoming a commodity.
It becomes commodity, but actually even prove, okay, does a multimodal approach to doing lots of things in advance, does it actually work? And for those people that it does work for who can afford it, great. It then provides a standing for us to then say, okay, how do we crush the gap between the wealthy and everyone else? And that's the work that Joe and Larry are doing, and all of us, in trying to scale that out. That is now proving itself to be effective in individuals, but we need to really deeply focus on translating that from extraordinary clinics that practice cutting-edge science and routinely use AI to do the kinds of things that Daniel was demonstrating today, and make that a reality for public health policy right through to your interface with your GP tomorrow. And I think that, for me, is the challenge that requires that optimism, it requires that moral courage, and it requires that sort of deep commitment to shifting from the market and the industry and the economics of treating disease into creating a much greater, more flourishing planet where, at the age of 90, we have the physiology and the cognition of a 60-year-old, and then hopefully fall off a physiological cliff or die whilst skiing, which is my aim. But so that's that. Your second question, sorry, was about trust, and I think about communication. We have to get way better. We have to get way better about communicating this stuff. We are so far behind the influencers because we believe in sincerity and credibility and authenticity. The world does not appreciate that as much as a good gag, a good sense of humor, something that makes people
visually
go, wow.
appealing. Yeah.
And I do think that we can actually use the word longevity in a positive way as a reframing alongside those who are using it for marketing purposes, and truly reframe our health systems around that to make them more inspirational, more aspirational, and less kind of defensive and scientifically boring. That said, if it's not grounded in science, we're in big trouble. But that's my view on the communication side.
So the whole shift that we're talking about in the broader sense needs a strategy. And during my speaking activities, I have the honor in visiting a lot of places on this globe. And every now and then you bump up to companies or people who are actually doing the heavy lifting that even within big corporates or within like an organization like WHO or academic medical centers or what have you, are being able to push the boundaries a bit further. And that, for one of those, for me, is Jan Liska, who I met a year ago. Jan is the global public health strategist lead at Sanofi, particularly on type 1 diabetes. And Jan, I would love to have you elaborate a bit on why is it that, first of all, it's often tough, seems tough within big corporations to get that change up and running. And on the other part, how you are actually doing that from within an organization like a big pharma company.
So I think that I will just answer the second question. I'm sorry, I can't give the answer to your first question, which is why is it tough? I don't know. If you start seeing the complexity, you probably get paralyzed and you don't move. I think it's part of your decision to decide that it's not going to be tough anymore. I mean, listening to this morning's presentation, listening to this panel, listening to Daniel, I actually remember November 2017. November 2017, I've been sitting as part of the cohort of the Singularity University at the NASA Research Center, listening to Daniel, talking to exponential medicine and talking to the fact that we should all find our moonshot. And I'm not a physician. I'm not a pharmacist. I don't have scientific background at the origin. And I decided that my moonshot would be to make health driven not only by medicine, but all the other sciences, the sciences of behavior. And Daniel, you mentioned it very rightly, that behavior is our biggest determinant of health. So I just decided that's going to be my moonshot. And in my jobs at Sanofi, I've been trying to make it reality. So today, I'm responsible for, it used to be an expertise. It has become a true job family in October 2025. And it's now real practice of more than 100 people around the world, which is called population health strategy. And when people ask me what population health strategy is about, it's the science of implementation. It's how do we actually make things real. And Daniel mentioned the 17 years gap, and I want everyone to keep this in mind. It really takes a pretty big portion of your professional life to see the fruits of your innovative vision becoming reality. When I'm thinking about what is my job, I've been actually making the counts. The Institute for Health Improvement has defined the triple aim and the quintuple aim starting in 2008. What the triple and the quintuple aim are, it's basically the end of single-focused change in healthcare. You can only achieve population health outcomes at scale if you simultaneously focus on 5 factors: the health outcomes you want to achieve, the optimal patient experience, the costs and their optimization, the quality of work for healthcare professionals, and the equitable access to care. And the 6 is the sixth sense that you need to make all those 5 happen at the same time in a pharma company. And so it has taken from 2008, 17 years to establish population health strategy as a job family. So we have not made this journey just because of Institute of Positive Health. We made this journey because there was a reason. There was a transformational shift in the way how we actually treat type 1 diabetes, from 100 years of reactive management to proactive prevention of T1D progression. And this is the cause we serve. This is the cause I'm serving here. This is the cause that my colleagues, Martin, Rose, Thomas, and Benoit, who is sitting in the room, are serving here. And we are excited to welcome all those who want to make something different in type 1 diabetes change to the workshop that we are hosting. So that's the whole philosophy behind how do we make it. We have a mission, we have a reason, and we decide that we do not accept the lack of implementation. Because as of recent studies have shown, more than 70% of health innovation are failing because of the gaps in implementation and the fragmented. So it's not the lack of science, it's not the lack of inspiration, it's the lack of implementation discipline. Does it answer your question?
I think it does. Thank you very much. We need to wrap this up. We started a bit late today. So Larry, Jack, Jan, thank you very much. There's keynotes after as well. There's also a session that Sanofi is organizing tomorrow between 11 and 3. There's a couple of seats open into it. I encourage you to speak to all of the other speakers. Thank you very much.
Thank you very much.
Meanwhile, I would love to introduce and ask Jessica Workham on stage, because we have a small announcement just prior to the break. ICT&health started as a magazine. Tom had the vision to create this new magazine in between all the others that were present already. Some on quality, some on structure, some on technology, but never one on the convergence. The second part that he created was this conference, where he said we need, other than only the digital aspects and only the print aspects, also for people to connect. And we're now announcing the next phase into it. Together with Jessica Workham, who will introduce herself in a bit, we today are launching, if everything goes right on the screen, a podcast series. Podcast, again, a podcast, yes. There's multiple podcasts, as we all know, of course. But the thing that we're trying to do here is that with our guests that we will host, not only during this conference, but also in the months coming, to ask the tough questions, not only what's the future like, but also what were the barriers that you ran into, and how did you solve them, the hashtag #HowTo. Jessica, could you introduce yourself a bit?
Yes, thank you so much. My name is Jessica. I am an intensivist, so a critical care physician, but I also have a background in biomedical engineering, and I have various roles in my hospital and beyond with regard to AI implementation in healthcare. And I'm super excited to have the opportunity, together with you, to host our new podcast, where we will not only focus on AI, but as what you mentioned, the steps toward implementation and all the prerequisites that we need to move towards that future that Daniel and the panel just painted.
Yeah, and if you can even have the second slide, this is not going to be sales pitches. This is going to be real people working on a daily basis, diving into the big chunks of barriers. Can I have the next slide, please? Where we try to bring together all the aspects. So it's the healthcare professionals, it's the support staff, it's the policy, it's the administrators, it's the financiers, it's patients, of course, as well. And we look very much forward to that. So we start recording the podcast today with all of our keynote speakers. But just be aware that we might trick you on one of those days and try to schedule also a podcast with you. If any suggestions for that, we're open for that, but we only have limited time for it, of course. So again, I'm looking very much forward to the collaboration with
Definitely. It. And don't forget to mention that what we're trying to do with this podcast is make it very accessible to share information, right? So we're not just doing the podcast, but we're leveraging everything we've learned
like AI?
With the help of AI into new forms. So we're repurposing that content to make sure that you get summaries and you get snippets and everything, because we don't need to reinvent the wheel, we need to share our lessons. So that's what we're going to do with the help of AI.
Looking forward to it. And with that, thank you very much. Over to Suni.
Thank you so much, Lucien. How many inspiring insights we've been able to catch just in the matter of minutes, really. It's incredible. So we're coming up on our break, and then we will have content sessions. Has everybody figured out their schedule yet? Who's still unsure about their schedule? Look at you, everybody's super organized. I didn't see a single hand going up. That's excellent. Well, so we are going to have a break from, you're going to hear the gong. It's scheduled till 11:30, but we'll see how we do it. You will hear the gong, and then you will know that once you hear that, you need to head over to your content session. Those will last roughly till about 12:10, probably 12:20, and then you're going to have lunch, and then we're going to go back into content sessions, and then we are going to see each other here back on stage in the main stage at 3:30 for 2 keynotes. And we've had a bit of a teaser with Larry sharing some of the work he's done. I strongly encourage you to come back at 3:30. We're going to have Esther Talbom and then Larry Brilliant here on stage for the keynotes. Until then, dive into the breakout sessions, make the most of it, show up with a learner's mindset, and enjoy, ladies and gentlemen. Thank you so much, and see you later.